Test item clusters for patients with neck pain likely to benefit from thoracic manipulation includes symptoms less than 30 days, no symptoms distal to shoulder, looking up doesn't aggravate symptoms, FABQ score less than 12, diminished upper thoracic spine kyphosis, and cervical extension range of motion less than 30 degrees. Can you go ahead and lift up your head? Good. Back down. Good. Go ahead. Test item cluster for subacromial impingement syndrome includes 3 tests. The first one is the Hawkins-Kennedy impingement sign. First, I'll get the patient to flex the shoulder at 90 degrees and forcefully medially rotate the forearm. Pain indicates a positive test. The second one is a painful arc sign. Patient will actively abduct their shoulder, and a positive test is indicated by pain in the range of 60 to 120 degrees. The last one is the infraspinatus muscle test. Patient's shoulder is in neutral, elbows flexed to 90, and hand is also in neutral. The therapist will apply a medial directed force, and a positive test is indicated by pain or weakness. Test item cluster for full thickness rotator cuff tear includes 3 tests. The first one is drop arm test. This is where I'll put the patient in shoulder abduction 90 degrees, and this is where they have to slowly lower it back to their side. Positive sign would be pain or weakness is present. The other 2 tests is painful arc sign and infraspinatus muscle test, which was demonstrated earlier. Test item clusters for mechanical neck pain that benefit from cervical manipulation include symptoms less than 38 days, patient's expectations that manipulation will help, cervical rotation, range of motion difference 10 degrees or more. All right, Alicia, can you rotate to your right, please? Good. And then can you rotate to your left? Okay. Last one is pain with posterior anterior testing in the cervical spine. So all I'm doing is doing a posterior anterior manipulation to the mid-cervical spine. Test item cluster for cervical radiculopathy includes 4 tests. The first one is the upper limb tension test of the median nerve. Can you type in opposite and type in this? Positive sign which would show any pain or numbness within the test. And then next I'm going to do the distraction test. Positive sign would show if there's a relief in pain. And the next one I'm going to do is the Sperling's test. Go ahead and bend to your affected side. Positive sign is if there's a reproduction of the symptoms. The last thing is the less than 60 degrees ipsilateral cervical rotation, which we showed earlier. Upper limb tension test TV focuses attention on radial nerve. Patient is supine with the arm abducted at 10 degrees and elbows flexed 90 degrees. Press the scapula with the hip and apply medial shoulder rotation, full elbow extension, and wrist finger flexion. To sensitize the test, the contralateral and ipsilateral cervical lateral flexion will be applied. Positive finding of the test includes a reproduction of the patient's symptoms or elbow extension range of motion difference of at least 10 degrees between the sides to produce symptoms. Differential diagnosis tests for rotator cuff tear versus a C5-C6 radiculopathy. With the rotator cuff tear, you might expect to see limited active range of motion, but full passive range of motion. A positive drop arm sign, a positive infraspinatus muscle test, a positive Hawkins-Kennedy impingement sign, a negative distraction test, negative upper limb tension test, a negative Sperling's test, and normal reflexes and sensation. With C5-C6 radiculopathy, you'll see a positive distraction test, a positive upper limb neurodynamic test, a positive Sperling's test, and a positive shoulder abduction test. A positive sign would be if a patient had an alleviation of the pain, a negative Hawkins-Kennedy impingement sign, limited cervical rotation, range of motion to the ipsilateral side, possible numbness and tingling in C5-C6 dermatome, possible weakness in shoulder internal and external rotation, elbow flexion and wrist extension, and diminished C5-C6 reflexes, which include the biceps and brachioradialis. The load and shift test. It's used primarily to check for atraumatic instability of the glenohumeral joint. Grasp the head of the humerus and center it in the glenoid fossa. The humerus is then pushed anteriorly and posteriorly, noting the amount of translation and end field. Differences between the affected and normal side should be compared. Active compression test of O'Brien is used to detect superior labrum tear. The patient's arm is flexed 90 degrees and the elbow is fully extended. The arm is then horizontally abducted 10 to 15 degrees immediately and rotated so the thumb is facing down. The examiner will apply downward force to the arm, and then the arm is returned to the starting position and the palm is supinated. Then the test is repeated. Positive results is pain, weakness, and clicking with only the first portion of the test. Lift-off sign. The patient places the back of their hand on their pocket. Patient then lifts their hand away from their back. If patient is able to do so, the examiner applies a force pushing their hand towards their pocket to test the subscapular muscle strength. Supraspinatus test, also known as the empty can test, is used to detect supraspinatus tendon pathology. The patient's arm is abducted to 90 degrees with the hand in neutral. Examiner provides a resistance to abduction. The shoulder is then medially rotated and placed in scaption or an empty can position. Resistance to abduction is applied again. Positive test would be indicated by weakness and pain.